Welcome to Ask the Dentist. I'm here again. I think this is the third time now. There's so much to talk about, again, with kids and their first dental visit with my friend and pediatric dentist, Dr. Staci Whitman. Dr. Staci. And we're going to dive deep on this topic of dental sealants today. A lot of moms and dads ask about that. I know I don't do sealants on every kid that I see, and I think everybody wants to know why. Staci wrote a great blog post on our website. I'll put that in the show notes with a really, really balanced kind of approach to who does need a sealant, who doesn't, which kid does. And so we're going to talk about like what do parents need to know when it comes to sealants? When should you consider sealants for your kids? Are there any reasons not to get sealants? Are they safe? How long do they last? So we're going to get all these questions answered. So Dr. Staci, who is a board certified pediatric dentist and a mom herself, I'm going to ask you again the tough question right off the bat. Why did you put sealants on your kids?
Well, so I believe sealants can be done properly. We'll get more into that. I guess the short answer is I'm really comfortable with my technique of placing sealants, and I'm very comfortable with the materials. She has extremely deep anatomy in her grooves. She actually traps food in them pretty frequently. And my overall concern is that although I'm trying to instill good habits in her, both with hygiene and diet, I'm not always going to have as much control over that once middle school hits and she's over at friends' houses and then, in the future. So I did choose to place them on her. I do tend to leave it up to parents. I just go over risks and benefits. And it's not every child. It really depends on the anatomy of the tooth and a lot of other factors as well. What is their diet like? What is their hygiene like? So those are things we can get more into, but that is why I did them on her.
So a lot of parents were going to ask, they're going to wonder, well, why did I ask that question? Because there are some kids that you don't want to do sealants on. Obviously, that's an important question because when would you not do a sealant? And why are we even asking this question? Is there a problem with sealants? What do we have to worry about?
So I always tell parents there are two concerns with sealants in my mind, because parents are starting to come in with concerns about them. They're reading that they're not comfortable with them. They want to know more. So generally, number one is what material are you using? Are there BPA, BSGMA, polymers, plastics essentially being used? And then what are the possible effects on the body and the system with those materials? And then also, and I see this very frequently, unfortunately, and have my entire career, you can seal bacteria or even a cavity underneath the sealant. And I do see that a lot, especially with patients that might be transferring. They've had sealants, but I'm noticing a shadowing, something suspicious underneath the sealant. And the tricky thing is it's really hard to see occlusal or chewing surface cavities on x-rays until they're usually quite big. So I explain it to parents like it can almost be like a sinkhole or like an underground fire type of effect. So we don't see it on the x-ray or clinically until they're really quite big. And again, these are your adult teeth. So it's quite concerning. The way you generally determine if there's bacteria cavity there, it's usually visual and maybe a little tactile. So there are now really wonderful scanners and devices that can be used to detect if there is a cavity forming that you may not see with your eye.
Without taking an x-ray.
Without taking an x-ray. And
right.
So that's a lovely addition to the practice. And then also you really want to make sure you're disinfecting as best as possible. And I'm fortunate enough to have ozone here. So not only are we really assessing to make sure there aren't any cavities, but then we're using ozone gas to disinfect the tooth surface to make sure there's as little bacteria as possible. We're cleaning it really well. And then we're using ceramic materials on top
Right.
of that.
Right.
So,
Yeah,
yeah.
I've seen that. I agree with you. I've seen that where I've placed a sealant. It was well after the tooth erupted, and 2 years later, you see the small lesion or the cavity, and you go in there, and it's interesting. You cut out your sealant, and underneath it, you see this nice little opening up of the groove, and you wonder, 2 years ago, should I have cleaned out that groove? And so it's really a technique sensitive procedure. What are the other safety considerations? I mean, let's talk about the BPA. Parents come in, I would say half of my moms and dads come in and they're concerned about BPA. I mean, it's in their water bottles, but they've read that it's also in any composite filling, plastic filling, and same material in sealants.
Yeah. So the concern is that BPA is considered an endocrine disruptor.
Mm-hmm.
And so that affects hormones, and whether
With a
it's growth.
developing child, that is very a big problem as they're developing to have that hormonal imbalance. Absolutely.
Yeah, and it could be growth hormone or pituitary issues or adrenal issues. It just varies. The counter argument is that BPA is only released upon placement, and then within 10 minutes, its peak exposure has decreased. There's research on that, but I'm just suspicious of that personally.
Right.
Especially with
BPA. There's BPA in other aspects of the child's life.
right.
I mean, it's in the lining of canned goods. I mean, it's in those little boxes that you get at Whole Foods or at the food bar. I mean, that's lined with those chemicals. I mean, it's everywhere. It's in water bottles, and then there's BPA free. And that the plastic industry was pretty sneaky on that. They essentially replaced it with something that, yes, it is BPA free, but it's still an endocrine disruptor.
Yeah, it's just a different one.
Right.
So there's different polymers, right? So, and then of course, we're just always trying to minimize our exposures. I mean, it's not to live in fear, but the environment, there's a lot of toxic exposures, and you're just trying to minimize it. You can't completely eliminate them. And some our body can handle and detoxify, but we want to try to limit it as much as possible. So that's the big concern with BPA.
Right.
I will add too, I think generally sealants, they're very often done by auxiliary team members. So I haven't always done this, but I do now since I've owned my own practice, but I really treat them very seriously. I mean, I treat them like a filling.
Right.
And so I think either the dentist should be doing them, or maybe a restorative hygienist or a restorative assistant, someone who's really trained in the intricacies. I remember working my first job at a school, and the assistants hated me because I always made them come get me when they were done with their sealants to check them. None of the other doctors did that.
Right.
I would go in and boop, they'd pop right off, or there'd be a ledge, and then that ledge catches food. If I hadn't checked it and left it, the ledge catches food and bacteria gets underneath it. So, it shouldn't be sort of a turn and burn procedure. It should be done very meticulously and delicately if you decide to do it.
You're absolutely right. A lot of dentists just love it because an auxiliary can do it, and it just adds to the cost of that routine dental visit. You're cleaning, and it's a moneymaker. And I think you're right. I love the way you said that. You have to treat it as if it's a filling. And if you're not ready to pick up a handpiece, and auxiliaries cannot, a handpiece is the drill, you get a fissurotomy burr or an air abrasion unit and cut into that groove, and which essentially then it is a plastic filling, but a very minimalist filling, a very conservative filling, then that person shouldn't be doing it. I agree. Any other safety considerations with sealants? And then also talk about how sealants, I get this asked a lot. And of course, as dentists, we're like, we don't think of this because we're trained and we know the tooth anatomy, but a lot of parents, the child will come back with an interproximal cavity and they'll say, you know what, you sealed that tooth. Why is there a cavity on this tooth? Talk about that.
Yes, I've heard that. I mean, that's educate. You have to communicate and educate the parent. We have models and pictures that we show exactly what we're doing step by step. We're only sealing the chewing surfaces. So we're only preventing cavities potentially on the chewing surfaces of the teeth, not the in-betweens. And that's where I can't emphasize flossing enough, which I talk about a lot.
Right.
Trying to limit our sticky, carby foods like crackers and pretzels and tortilla chips and
Right.
granola bars and things of
Right.
that nature that get stuck down in there and cause
Right.
problems. Yeah.
So how about, I mean, I tell parents that I'll do a sealant as long as you can get the child in right when the tooth is erupting. In other words, when it's completely, when the crown of the tooth, all the cusps are free and clear of the necrosing tissue, the tissue in the gum line, that's the time that I want to do it, because the longer that tooth is exposed to that starchy diet, which you just referred to, then you could be covering up some bacteria when you do that sealant. Is that practical? I mean, and how does the parent know? What do you tell the parent what to look for? Sometimes I have parents that bring them in too soon. I'm like, oh, there's no tooth present.
Well, we try to time it. If a child comes in and I can tell they're not quite ready yet, I usually will say, let's get them back in 3 months.
Okay.
And as a practice management, practice flow, it's not 100%. We do try to show the parent, again, with a photo, what we're looking for. So call and cancel the appointment if the tooth doesn't look that way. But if for whatever reason we have to bail on the sealants, we use it as an opportunity to go over hygiene instruction, or, there's plenty of things that you can do educationally to fill the appointment time.
Right.
And then if I do see a child late and maybe I'm starting to see staining or concerns with almost pre-cavity type of lesions, you mentioned opening the grooves up, and that is usually what I prefer to do if the teeth have been in for a while and we've decided sealants are a good move, is a little air abrasion, or enamelplasty is what it's called. And I know like the dental world goes back and forth with do you remove tooth structure or not? But I mean, it's honestly so minimal, the amount we're
and if the groove is decayed, I mean, that's a weak spot. Might as well.
Right.
And it's just a very thin vertical part of the tooth.
Yep. And with the screening tools too, I mean, we have more information here at the office, but yeah, I mean, I'd rather remove just the teeniest bit of enamel to ensure there's not a hidden cavity underneath than to seal it. And then 2.5 years later, there's a big issue.
Right. Plus the retention of the sealant is improved.
Yeah.
If you have that groove. And then, so let's talk about, don't let me forget, I want to talk about the cost and whether insurance covers it. It's a preventative procedure. But let's first talk about the process of a sealant. What would a parent expect? Is it done at the time at Profi? Is it a separate appointment? How quickly does it happen? Does the child have to get numbed, anesthetized?
That is all. So the timing is really up to the office. I prefer not to squeeze sealants in. I would rather them come back for a specific sealant appointment. So again, we're not rushing. If we have extra time, we will offer them same day, but very often we do have the child come back.
Right.
So be careful of that, I would say. If they're like, we have 5 extra minutes, we can do sealant. Sure, it should take more than 5 minutes. Yeah. So I'd be careful with that. It's pretty easy. I mean, it's really straightforward with the kids. You do not need to numb.
Right.
Sometimes if a tooth's hypoplastic or hypomineralized, those teeth are much more sensitive to hot and cold, and we do have to use water and air.
Right.
And those teeth, number one, they really should be sealed, in my opinion. And those sometimes do require a little anesthetic to keep the child comfortable, mostly just from the air and the water.
Right.
If you have a child who you've been told has hypomineralized teeth and they can't drink cold liquids, or, their teeth are really cold sensitive, they might need a little numbing. The key to a good sealant is you really do need it isolated, no saliva, so that, there's a lot in the mouth, but it's really not difficult for the child as long as they're okay with things going in and out of their mouth. Sometimes a little nitrous at my office does help the child, especially if they have a gag reflex, because nitrous helps with gag reflex. It helps with anxiety too. But so anyway, we'll isolate the tooth, maybe a little nitrous, maybe not. And then we use an etchant, which is like we call it like a tooth soap. It cleans the tooth. It kind of opens the pores of the tooth.
Right.
I
call it shampoo, tooth shampoo.
Shampoo, and this is after we've, checked it for cavities, scanned it, pumice it, rinsed it, ozonated it.
Right.
Then we use our etch, which is our shampoo. You rinse that off.
Yep.
Then you use a bonding agent, which is like an adhesive. And it, for anyone who's maybe had fake nails, it's a very similar process. It's the same process as a filling.
Right.
Some dentists use adhesive, some do not. I personally always have. I find that my sealants stay on indefinitely so far in my career. It takes an extra step. It takes more time, but I do feel they stay on a lot better. Right. And plus I'm using a ceramic material, and I'm using like a filling material.
Right. It's a filled composite.
Yeah.
It's not just the resin, which is, it flows nicely. But, and then I think what's really important, and a lot of dentists don't do this, they don't polish the sealant. They just count on that flow and that wettability, and then they walk away from it. Where I think polishing it, as you said earlier, there are little edges where food could get caught. Also, a hard piece of food can get in there and flake that sealant off. So that's important to kind of buff it out or polish it.
Yeah. So I absolutely, all good points. So we do the bond, and then you have the light here, that blue light that we use, and then we'll use our filling material, our ceramic flowable material. Right. And then we make sure we're moving it all around the grooves, and then we smooth it out, like you said, and we cure it again, and then we polish it, like you said, to make sure there's no rough edges or discrepancies that you can't see visually. It's kind of. So
I think it's pretty clear now that you cannot do this at the end of a cleaning appointment. So I'm glad that it has been illustrated here what we're talking about. So how much do they cost? How long does it take you to do a quadrant? Maybe 2 or 3 teeth, and does insurance cover it? I mean, what typically? Just give us an idea. Because I know a lot of patients ask. The
answer to this question. I know it's in the article we wrote.
Right.
So I think most insurance do cover them. They're considered preventative.
True.
I do not know what I charge for my sealants. I want to say $80,
right.
$60 to $80, something around there.
So it's cheaper than a filling, less than half.
Much cheaper.
Yes, right.
The thing with the filling is we know fillings don't last forever, and they usually need to be replaced. And so I forget the number, but there is some number floating around that once you touch a tooth with a filling, how much does that cost you over the cost of your lifetime? Right. And it's usually hundreds of dollars.
Exactly. So it's a good investment.
Yeah, I mean, it is if they're done appropriately. I want to add too, adding to the end of the cleaning appointment, it may be convenient because you don't want to come back to the office, but I'll say most kids are pretty spent. They're tired. Their mouths are open. They're exhausted. They're just over it. And so then you're also just you're just making it maybe a negative experience because you're trying to just do one more thing, and so it's harder to isolate and do a great job. And then the child, instead of leaving kind of happy, that was easy, I had a great cleaning, they leave kind of disgruntled and sour because they were like, oh, I'm just tired. I didn't want that to happen.
Right.
So,
Now, that's a very important point. And I always, with the kids, the parents are like, we're here, we've gotten this far, keep going. And I always say typically at this point, I go, no, we've had a victory here. We've had a win. Let's end at this so that the child wants to come back. Yes. And so that's a very good point. I love that. It took
me a while to just learn, it's the practice of dentistry. We're learning every day, every year. And that took me a while to learn, but I agree with you. I want the child to leave this pumping and excited rather than to push them for convenience, and then they have a negative impression of the dentist.
Exactly. So and sometimes that's after a half hour of just trying to coax the child to open their mouth, and once you get a quick look, sometimes I'll end it there and go, okay, step 1, we did it, it's a win, let's reinforce the behavior, come back in 1 week.
And then you just build on the positive experiences.
Exactly.
Most kids, adults too, have about 20 to 30 minutes of attention span. I notice that even in lectures I go to. I start to get restless and I look down like, yep, I've been here 30 minutes. It's hard to stay focused. So
Right.
it is also at the dentist.
Right.
So yeah.
Well, before I wrap things up on sealants, I want to ask one more question. Are there any contraindications would you ever not do a sealant on a child? When is that? I know we've kind of touched on it, but just to wrap up, how often do you do sealants in your practice? You're a pedodontist, right? I mean,
Yeah.
how do you see our kids?
I would generally say frequently. I mean, I would not do them if the grooves are pretty shallow, and I do see that.
Mm-hmm.
There
that's a genetic thing. That's genetically determined, right?
Yep, it's just like the shape of your ears, you
Mm-hmm.
know, it's the shape of your teeth.
Mm-hmm.
So also if hygiene and diet is impeccable, you know, I often will say, I think they're fine. And it's really just an open conversation I have with the parents. I definitely don't do them if I think it's going to be traumatic for the child. So if they have a hard time with x-rays and they have a hard time with their cleaning and they have a really strong gag reflex, or maybe they have sensory issues, or maybe they're autistic, you know, you could argue some special needs sensory children, they're higher risk. So the sealants may be more valuable, but I also have to balance the emotional effect of it. So if we're pushing this on the child, I prefer to kind of earn trust and take baby steps too. So I want to keep it positive. There's enough negative dental memories out there. I really try not to create any more, especially for something that's considered preventative.
Right.
You know, it's an elective procedure. So.
And that's what we're going to talk about in our next session is dental anxiety. And I would encourage everyone, that's probably the most important. If you're going to listen to any of our little interviews and talks here, I would say the dental anxiety is the most important. So anyway, so let's end it there. Thank you very much, Staci. That was great information.
Yeah, sure.
And again, you're always an incredible resource for parents, those nervous parents out there. I think pretty much any parent is nervous, right? I was nervous.
Right, I'm nervous.
Absolutely, right. That's just being a parent. So, but for everybody listening, if you'd like more information on dental sealants, thank you, Dr. Staci. You wrote a beautiful, fantastic guest post on our website. I would definitely read that. That's a great resource. And maybe print that out before you go in so you can refer to it. And then also for everyone listening, if you'd like more information on how to find a dentist like Staci, a functional dentist, then go to askthedentist.com/directory, and you'll be able to find a dentist that keeps all these things kind of in mind and is treating your child as if it was her own child. So I think that's very, very important. So again, thanks for listening, everyone, and we'll see you in the next chat.